안녕하세요. 안녕하세요. 오늘은 또 다른 인터뷰를 하려고 합니다. I'm gonna introduce my friend. She's a young, promising lady, Madam. Madam Lynn. She's working in one of the biggest hospitals in New York as an FNP nurse practitioner. She also graduated very popular Ivy League NP school. She majored in family
FNP,
FNP.
Family Nurse Practitioner.
Family nurse practitioner. So, okay, would you please introduce yourself to Korean subscribers?
안녕하세요.
No!
My name is Lynn. I am a nurse practitioner here in New York and also sales friend. And I'm really excited to be on today's interview. So we look forward to talking with you about what it's like to be a nurse and an NP in the US.
Oh, cool. Actually, she can speak Korean.
No,
A little bit. Little bit.
I learned from her. My pronunciation is very bad though.
I don't think so. Your pronunciation is so good. So, how many years have you worked as a nurse practitioner?
I started in 2021, so I'll be approaching almost 5 years now.
Sounds like you're already expert. That's 5 years, pretty low.
I still feel like I'm in the beginning, like I'm learning things every single day.
Humble.
Like,
Ivy League and humble.
each year I like set new goals to myself and to say I want to learn a new skill or learn about a new condition. That way it keeps my mind fresh and it keeps the job interesting because then the more you learn, the more diverse patients you can see.
So as you're working in big hospital, I'm curious what's the experience like?
Everyone's experience is different because a lot of it depends on what specialty you go into. Most of the learning happens on the job. My experience is basically just working in an outpatient clinic. I see patients from 9 o'clock up to 3 or 4 o'clock, 5 days a week. But in between, you are exposed to a lot of academics, weekly presentations on patients from different doctors and the residents. We have visiting professors that come from all over the country.
How many patients you have per day?
It depends because let's say new patients are typically scheduled for like 30 minutes. Follow-up
30
patients are 15 minutes.
That's really long, 30 minutes.
It's not long. It's not enough.
Really?
Because that is the time you have from the beginning to end, you know? Everything from vitals, getting labs, seeing the patients, documenting. So in reality, it's rarely ever enough.
So the first question.
Yeah.
I only
That was
guessed
not the
last.
first.
What is the big difference between nurse and MD?
An MD is obviously like a medical doctor, someone who's gone to medical school. An NP is essentially a nurse who has gone back to school and gotten her master's or her doctorate. In NP school, you learn how to evaluate, diagnose, and treat conditions. Here in the US, nurse practitioners are often used to fill in the gap. For example, I work in a surgical specialty, so all the doctors or surgeons, it's helpful to have someone like me who can see non-surgical patients, leaving them on the surgeon's schedule to see all the patients that need to be seen for surgery. Nurse practitioners can also work independently as well and open up their own clinics, whether it's a Botox clinic or a family medicine clinic. A lot of options in terms of how one wants to, go into that career.
Thank you for the answer. I'm curious why New York?
I got into grad school here.
But after graduate, you can decide to go to other states, but you decide to come here, so I'm curious.
I just wanted to live in New York City.
Okay. Okay, so do you think which is the advantages to live in New York City?
In terms of lifestyle or
Yes,
work?
yes, so just a general.
I think it's such a fun city.
Yeah.
Anything you want, any time of day, you can get. Everything you're exposed and have the opportunity to see so much and experience so much.
What type of opportunity?
Things like Broadway shows, or if you want to get international food at any time of day or night, you can get that. Exposure to fashion and music and concerts.
Do you think which is the big difference between Massachusetts and New York City?
I think if you were like to move to Massachusetts, most people end up in a city like Boston, probably. Boston is a very nice city, which you're gonna be living in as of next.
yeah.
It's a much smaller city though. It's very diverse, but I don't think it's as diverse as New York. So you just don't have as much of that cultural diversity, I should say.
Culture diversity.
Right.
You wanna recommend to live here?
I think it depends on everyone's preference. I think New York is a really fun city to move
Yeah.
to, but it does not represent the rest of the United States. It's very different than the rest of the United States.
I heard many people say New York is different country. Do you agree with
Sometimes
that?
it feels like it, yeah. Sometimes it definitely feels like it.
So when it comes to work, as you are working in New York City, would you please share a little bit more? When I start to work in hospital in Korea, I feel like it's a little bit different from textbook. I feel like there's something like hierarchy in hospital settings. Before I moved here, I heard nurses are very respected here and perceived as a good job.
I think I could actually combine those two questions in one answer. In a good way.
I provide you
Generally, nurses are well respected. Even on studies, they find that nurses consistently rank among the highest trusted profession. So like, I remember even when I was like growing up and I told people that I like wanted to go into nursing, everyone was just so happy and so excited. People truly love nurses and trust nurses here. In the hospital setting, here the culture is that every team member, whether it's a doctor or the nurse or the PCA, is a healthcare professional. Have the opportunity to bring in like their own experience and their own expertise. Nurses especially have quite a bit of responsibility and autonomy, and they are encouraged to advocate for patients. They can initiate protocols if needed, very much encouraged to speak up when needed. So it's considered, the culture here is collaborative team. Every person brings in their experience and their background so that we can take care of patients well. You know, you may even hear of like nurses are hit by a patient or
That's true.
abused by patients and the hospital is not helping them. Those things do happen, but it's not the culture. It can be isolated events. Generally, the culture is collaboration for sure.
So you mean even though sometimes we face hardship and difficulty, but generally we'll trust it and perceive it. So you love yourself as a nurse, nurse practitioner.
People really love nurses. Maybe you've had your own experiences where a patient is like, thank you, nurse.
Right. I think it's a kind of good circulation. It's the people trust medical professions. The professions also, we try not to make them disappointed. We need to do our best in the way we offer good care, and also they trust. Again, it's a kind of good circulation. So we just need to focus on the patient. It should be the priority, not hierarchy, any other things.
Yeah.
That's beautiful. Thank you.
You're welcome.